Chapter 13 of the ICD-10-CM coding guidelines talk about the diseases of the musculoskeletal system and connective tissue. Okay, so it starts with this topic that says side and laterality. Let's read this, guys. Most of the codes within chapter 13 have side and laterality designations. The site represents the bone, joint, or muscle involved. For some conditions where more than one bone, joint, or muscle is usually involved, such as osteoarthritis, there is a multiple sites code available. For categories where no multiple site code is provided and more than one bone, joint, or muscle is involved, multiple codes should be used to indicate the different sites involved. Okay, so it's too big of a paragraph, too much narrative here, guys. But let me just sum it up to, to make this narrative more simple to understand. It basically says, and everybody understands what musculoskeletal is, right? Musculoskeletal composed of of course, our bones, our joints, our tendons, our muscles. Those are the musculoskeletal. Now, when you're assigning codes for these type of disorders, usually this type of orders, guys, are current conditions or conditions that just recur. And one example that was given here is osteoarthritis. Is anyone here doesn't know osteoarthritis? Probably, right? So if you guys are relatively young, you probably don't have any idea what osteoarthritis is. Osteoarthritis, which one good example, and this is one of the central discussion here in this chapter. Let me write down this big clinical word, guys. Osteoarthritis. Okay. So the way clinical terms, guys, are organized, this is how this is just my observation, and I've seen this pattern. Usually, how clinical terminologies or names of diseases or names of disorders are put together, guys. They kind of like put combination of words and also the description of the words and how bad it is. So that's how, from how I understand it, coming from someone who is not really does not have a formal clinical background. I just learned these medical terminologies during the course of my practice. Now, look here, guys. Osteo means bone, okay? So every time you see or hear the word osteo, that means bone, okay? Arth, right here, means joint. So it's the convergence of the bone and joint. So that's what osteo and arth means. Itis, every time you see the word itis, this means inflammation. Okay? So inflammation, that's in a simple description is that every time you see this suffix itis, it could mean an inflammation due to an infection or inflammation because of overuse. Okay, like yes, Jess, like gastroenteritis. So when you say gastroenteritis, look here, guys. Thank you, Jess, for that example. When you look at this word, gastro means this is your stomach. Okay. Enteritis, this is the small intestine. Small intestine. Then you see this itis here. This is inflammation. So when the inflammation happens inside the intestine, chances are this is an infection. Okay. I'm sorry to hear that, Jess. So that's what I meant about how these clinical terminologies are fused together to mean something really clinically significant, right? So osteo, bone, arth is joint, itis is inflammation. So there's something going on. There's inflammation in that convergence of of the bone and joint. Okay. Now, the guidelines are talking about when in this particular chapter, guys, when there are conditions involving this system, the musculoskeletal, you have to assign as many codes as possible, okay, which, the site have been identified, okay, based on the identified location or laterality. So, meaning if a person has osteoarthritis of the hip, of the knee, of the shoulder, this shoulder, not this one, this elbow, you got to assign all those, all those osteoarthritis codes specific to that site and laterality every time you encounter that condition. So that's what the guidelines were trying to say. Okay. Now I broke it down to, in my little presentation here, I broke it down here to make it more simple. Okay. Assign codes for bones and joints disorders as many sites identified. Okay. Osteoarthritis of a specified sites. If site is not documented, assign code for unspecified osteoarthritis. So that's basically what this bones and joints being a condition which we call a degenerative disease of the musculoskeletal system. Now, it is very important that coders understand the difference between a degenerative disease and degenerative disease and an injury. Okay, especially for musculoskeletal, you have to be able to identify whether this condition is a degenerative disease or this other condition is actually an acute injury. Now, why is that? This is the reason why. If you're assigning code for degenerative disease, guys, okay, you're basically saying that this disorder or this disease was not a result of an injury. Okay. Now, if you assign a code for an acute fracture, a musculoskeletal system can also have, conditions as a result of a fracture. But an acute fracture compared to like osteoarthritis, the acute fracture is a result of an injury. The osteoarthritis is not. It is a bone degenerative disease. You guys see what I'm saying here? Now, the reason why it's important for coders to understand that because the code is very different. Very, very different. Many coders or non-trained coders usually make that mistake. Okay, when a person or a patient suffers an injury or a fracture, okay, because of secondary to the weak bone. Let's say, for instance, patient has a bone cancer, okay, and because of this bone cancer, patients that specific part of the bone is very weak, it's very brittle. Now, when a person suffers a fracture in that weak bone, okay, that is what we call a pathologic fracture. Whereas if a patient suffers a fracture from an accident or from a blunt force that is applied to the body part, then that's different. That is an acute injury. Now, the acute injury has a separate code. A fracture that is caused by bone degeneration has a different code. So that's what I'm trying to say. That's what I meant about you really need to be able to separate the two. Okay, bone degenerative disease compared to an acute injury. Is that clear, guys? So we're still in the introduction. So that's the fundamentals in assigning code for this chapter, guys. That is very fundamental. That's very basic that you guys need to understand, so that moving along, you guys will now be able to, of course, to relate to what the guidelines are saying. Okay, so we have that bones and joints degenerative disease. Okay. Now, I have already explained to you guys the difference between an acute, traumatic versus chronic or recurrent musculoskeletal conditions. Now, let's read this, guys, and to reiterate what I have just explained to you. Number one, determine the nature of the bone and joint disease, whether it's chronic or recurrent degenerative disease are assigned. Chronic or recurrent degenerative disease are assigned the codes from musculoskeletal system. This is what I'm saying, okay? Now, the musculoskeletal system, guys, those codes start with letter M, okay? Now, on the other hand, the acute musculoskeletal traumas caused by strong impact, sample, fall from high place, motor vehicle accident, assault by blunt force, they are coded as acute injuries, and your code will start with the letter S. Do you guys see the difference? This one, bone degeneration, starts with letter M. The acute injury starts with letter S. It is the same principle. I don't know if you guys remember when we were in the discussion of an ulcer and the wound. The ulcer, guys, is coded to a different chapter, while the wound is coded in a different chapter. When you say ulcer, this is not an injury. This is a result of something else, like if patient has what we call a peripheral or arterial disease, or what we call a gangrene disease. Another thing is if a patient has what we call a pressure type of injury, right? So that's different. While the wound is coded to an injury, wound is coded to a laceration. Okay, when you sign a code for the wound, if the doctor says patient has wound in the buttock, you got to make sure that does the doctor mean pressure ulcer, or does the doctor mean it is an injury because of an accident? So you got to make sure be able to tell the difference from one to the other. Okay. Now let's go back to our fracture here, to the injury. So acute musculoskeletal, again, caused by traumas, is coded to this chapter here, which is actually chapter 19. We're still in chapter 13, so we're still kind of like a long way from that chapter. Okay. Let's go back to what the guidelines say. This is what the guidelines say. Hey, for certain conditions, the bone may be affected at the upper or lower end. Okay, a vascular necrosis of bone, M87, or osteoporosis, M80 to M81. Though the portion of the bone affected may be at the joint, the site designation will be the bone, not the joint. Okay, so what does it say, guys? It says that if the affected part of the musculoskeletal region is the bone, you have to code it to the bone, not to the joint. Which means, guys, that here's what this guidelines is saying. Imagine you are assigning a code for a pelvis, okay? When you talk about pelvis, guys, you're talking about hip, right? Pelvis equals hip. Now, the hip, guys, involves a joint, right? So let me see if I can draw a little bit of Okay, so I'm bad at drawing, guys. What I'm trying to say is that somewhere here, this bone here is connected to that. This is the hip. Okay. Okay, that's the hip. This is the knee part, right? This is your the knee. Okay. Now, what the guidelines was trying to say here, guys, is that when the documentation says patient has say osteoarthritis, or patient has a fracture of the pelvis, so you are to code it to the bone, which is what bone is this? This is the femur. Okay, that's the femur. The guideline said the bone will have its proximal and also the distal part. Proximal means close to the center, That's what proximal means. Okay, so close to the center of the body. So the hip is closer to the center of the body, while this one here is the distal. So the guidelines are trying to explain to us that if the documentation says pelvis fracture, you have to code it to the bone, not to the joint. Does that make sense, guys? Okay. Now, guys, coding for every scenario, for every time that you are assigning code, the goal here is to be very specific, okay? Very focused on that injury that you are trying to code for, or that disease that you're trying to code for. So the goal for every code assignment is to assign to the highest specificity. That's the goal. And this is the reason why guidelines are very particular to that instruction, saying, hey, if it's the bone, you have to code it to the bone. Karen has a question. If the joint is made up of several bones, which bone to use? Very good question. So if the bone has if the joint has many bones, you want to make sure that you assign it to the bone that is identified in the scenario, because the documentation will sometimes only tell you this is knee fracture. So knee guys involves many bones, right? Or many parts, like the tibia, okay? Also the femur, that's also part of the knee joint. So you want to make sure that if it's not clear to you what bone to assign, usually if the doctor says knee fracture, there is actually a code for knee. It identifies the knee. It's not the femur. It's not the tibia. So for that question, I mean, if you're not so sure, you got to query the provider. Okay, but from what I understand, what I remember is that when you say knee, there is a specific code for the knee itself. Okay, so what the guidelines are just trying to explain to us, guys, that when like what is indicated here, okay, though the portion of the bone affected may be at the joint, the site designation will be the bone, not the joint. So we want to make sure that you are coding it to the bone that is identified, if regardless if that bone meets or converge in that particular joint. Let's go here. Acute traumatic versus chronic or recurrent musculoskeletal conditions. I have already set this out. I already explained to you guys what this is, right? Earlier, I talked about coders need to be able to identify the recurrent or chronic condition of the musculoskeletal system compared to the acute injury. So it is very, very important. So it's just a repetition of, the guidelines is just a repetition of what I have just explained. Meaning that, look here, guys, the musculoskeletal, the recurrent conditions are coded in chapter 13, which we are talking about now. The other one, the acute injury, look here, acute injury are coded to chapter 19. Now, when we get to chapter 19, guys, I will show you what these acute injuries are and how to assign the code appropriately. Okay, now let's go to coding of pathologic fractures. Okay, all right. Let me go back here and let's see if I have coding of pathologic fractures. What I have indicated here, meaningful application of 7 characters. Okay, let's read this first. The assignment of the 7 characters is based on whether the patient is undergoing active treatment and not whether the provider is seeing the patient for the first time. And I will explain that to you guys in a little bit. Now, in the coding guidelines, the explanation here actually is here, okay? Coding pathologic fractures, it talks about different 7 characters, which you guys have already heard from me what the 7 characters are. Okay, but let's read this. 7 character A is for use as long as the patient is receiving active treatment for the fracture, while the patient may be seen by a new or different provider over the course of treatment for a pathological fracture. Assignment of the 7 character is based on the whether patient is undergoing active treatment and not whether the provider is seeing the patient for the first time. Now, I just captured this statement here and put it in the presentation right here, but let's go to the presentation so it looks more simple, guys. And I'll do my best to explain it in the best way I can, the simplest way I can. Okay. It says here, initial 7 character A is for use as long as the patient is receiving active treatment for the fracture. Let me put this 7 characters on the board. But before we go even further, explain to you what those 7 characters are, or the specific 7 characters, let's identify first, what do I mean by 7 characters? I know you guys heard about this, in the early days of our discussion. But let me remind you again, this is highly important, very, very important that you guys understand, because it involves money, okay? It involves reimbursement. So let me write down 7 character here. The ICD-10-CM, okay, for the ICD-10-CM, guys, was implemented, code set was implemented in 2015. Now, why I'm saying this, okay? The reason why I'm saying this is that back in the day, before 2015, the system that the country, our country, United States, use is the ICD-9. We're kind of late in adapting to ICD-10, where everybody else, by the way, guys, ICD is internationally implemented. Like all countries use the ICD-10 system, coding system. Now, it depends on which version it is. Okay, it started with 1, like in 1800s. Now, in sometime in 1970s, I think the ICD-9 came into play. It ran for like from 70s to 2015. How many decades are those? 4 decades, right? So it ran from that time up to 2015 before we transitioned to ICD-10. Now, the reason why I'm explaining that is the ICD-9 version of the code sets, guys, does not have the 7-character application. There's no rule about the 7-character. In ICD-10, the 7-character became a thing, right? It is now implemented. Now, reason why this 7-character is important is that because this is the 7-character, guys, is applied to any injury, okay? Any disorder or any disease as a result of an injury. Now, what are those 7 characters? The 3 most common ones are A, D, and S. So A stands for initial. D stands for subsequent. And S stands for sequela. The one we just read, guys, and I will show you in a little bit how the 7 characters are applied. Again, you might have heard this before, but you know, we have not talked about this for months, and now I'm refreshing your memory, guys, what these 7 characters are. Okay, it says here, initial 7-character A is for use as long as the patient is receiving active treatment for the fracture. So what does it say, guys? What is the emphasis here? As long as the patient is receiving active treatment, it is a very important statement here, for the fracture. Let me give you an example of a fracture code. Okay, let me go to the book and let's go to fracture of the, of the hip. Let's see here. Let me see. M80051. I'm just trying to give you guys a most common one. Okay. Wait, I'm here at M80051. Okay, let me write it down, guys. Okay. Okay. Is my writing readable? Yeah. Okay. M80051. This is fracture of femur or pelvis. Now, the 7 characters being mentioned here, guys, look here. Your code here is only composed of 6 characters. And 1, 2, 3, 4, 5, 6. Correct? The 7 character, which is these guys here that are very common, okay, for every injury, like a femur fracture here, in order for the payer to understand whether this is a fresh injury or an old injury, okay, you have to assign a 7 character. In that case, I'm assigning initial here. We don't have the scenario yet, but I'm just showing you guys how the 7 character works. If I put letter A here, I'm basically telling the insurance company, the payer, that this is a fracture that is receiving active treatment. Does that make sense? Look here, guys. As long as the patient is receiving active treatment for the fracture, what 7 character you are to assign? A. Now, why is that important? Okay, why is that important? The reason why it is important is that because you're basically telling the insurance company, hey, you have to reimburse me, you know, the kind of payment that is appropriate for a scenario where patient is receiving active treatment. Okay, now because patient is receiving active treatment, that means to say I'm spending this much. I am employing a specialist here, an orthopedic specialist. I need payment for my nurses who's taking care of the patient like 24/7 for 7 days, because this is a fracture that is, that just happened. Okay, that's what initial 7 character means. It doesn't really matter whether a patient is seeing the patient for the first time or for the second time or for the 50th time, as long as the patient is receiving active treatment. Does that make sense, guys? Because there are times, guys, that when the injury is so severe, there are times that the patient will have to undergo like series of treatment, right? Like if the bones shattered into different pieces, right? So if the bone shattered in different pieces, then the doctor, the orthopedic surgeon will have to put the screw one day. The following week, the doctor will have to adjust the screw, the plate, the rod, and stuff like that. Okay, so as long as the patient is on active treatment, you are to assign this initial letter A, because you want to be paid, or you get paid appropriately. So that's the importance of the 7th character.